Hey everyone, today I want to talk to you about my treatment for my breast cancer. I was diagnosed with breast cancer November 20th, 2019, and you learn so much once you get a diagnosis. You learn about cancer, you learn about breast cancer, you learn about your body, you learn about the specific tissue inside of your breasts. And so it has been quite a journey to even travel to here in learning all the new things that I had to learn about my body once this diagnosis came my way. So, real quick, I did have a lumpectomy. In that lumpectomy, it was quite large because I had 3 tumors in there. Come to find out, I had 4 tumors in my left breast. And after that, we also discovered, of course, we knew then what kind of breast tissue I had. So my specific cancer is lobular cancer, but my breast tissue is full of something they call lobular carcinoma in situ, LCIS. So lobular cancer in a diffuse background of LCIS. That's my specific cancer and my specific breast type. So it became clear that the best treatment for me would be to have a double mastectomy, and I came to that conclusion. I was very clear about that once we had this information. So what do you do then? You know, you're going to have a double mastectomy. Well, there are options for women, and I had to discover the options, talk to multiple surgeons, plastic surgeons. I talked to multiple breast cancer survivors. I listened to YouTube videos of breast cancer survivors and women who are going through their treatment now. And through all of that, I came to the decision that for me, I did not want to have immediate reconstruction with implants, but I did want to have immediate reconstruction. So immediate reconstruction, if you're not going to use implants, it's pretty exciting, I think. They can use your own body tissue to make new breasts out of your own tissue. So part of my process was learning about implants, and so many women have implants. They love their implants, and it's a choice for them that they would gladly choose again. For me, it just wasn't something I wanted to do because when they put an implant in immediate, they put in these space holders after surgery. And what they're doing really is taking the pectoralis muscle off of your chest. So they're like taking the muscle off the chest, and then they put in these expanders in between your chest wall and your pectoralis muscle. And then over the months, they fill the expanders, and your pectoralis muscle has to grow and stretch in order to have the space to hold the implant for whatever B, C, D, whatever cup size you choose. And some women fly through that with no problems. And then, you know, as with any surgery, there are risk and reward to both sides. So for me, because I work out so much and I so value my muscle, and as I'm aging, I want to keep all the muscle I can. So for me, I did not want that option. But the other option is called DIEP, DIEP. And basically what it is the surgeons will take off my breasts and spare my skin. So keep my breast skin. I believe we will save my right nipple because there's nothing wrong with it there. I will lose my left nipple because the 4th tumor is right behind the nipple, and it would be too much of a risk to keep the nipple for the future. I don't want to go through all this surgery and then have a cancer cell or 2 left in there. So skin sparing, right nipple sparing, and then they cut the fat off of my abdomen and they take just the fat and the blood supply, no muscle. They do not cut into my abdominal muscle, which for me is very, very important. I don't want you to touch my muscles. So I will have a scar from hip to hip, and they will take out fat, and then the specialist vascular surgeon will hook up my own fat underneath my skin on my breasts, and they will hook the blood supply from the fat into the chest wall. So the fat will have circulation, right? It will have blood supply, so it will be living. And they shape the breasts from my own fat. And so while it is a large, large surgery, of course, because I'm having a mastectomy and the abdominal deep flap and reconstruction all at once, it is my surgery of choice. So I'm very actually excited about the choice, and excited that a part of my body gets to be the healing presence for the other part of my body. And that's how I choose to look at it, that my body is working to heal itself with its own tissue. And to do that, I have chosen to go to the Center for Restorative Breast Surgery, and that's down in New Orleans. So I'm just very excited. I've been speaking with the professionals there for over a month and a half now, and they have all my labs and my pictures, and I'm just very, very excited for this treatment option. Now, I'm excited, even though I know it's going to be huge and the recovery will be another story. But today I'm just telling you about my treatment option and why I chose that option. And I hope you continue to follow me here, and I will tell you more about it as it happens. So that's it. I'm going to do a double mastectomy with immediate reconstruction with a deep flap, and this center, they do a specialized surgery called the APEX, APEX, and it's where they do take all that fat and the blood vessels without touching your muscle. So it's a specialized treatment to the abdomen, and they have all kinds of monitors and just wonderful care to take care of me in the days post-op. And they have a whole hospital dedicated just for women such as me who are going through reconstruction. So again, that's the Center for Breast Surgery down in New Orleans, and that's where I've chosen to have my surgery for my cancer. So that's part of my decision-making process, and I just wanted to share that with you because for every woman, it's different, and for every woman, there are so many choices that you need to make. And some women don't have a lot of choice because of their particular breast cancer or their particular circumstances of their bodies and where they live, all kinds of things. So I'm very grateful that I have choice, and I just want to share that in case any other women are dealing with this type of thing and want to hear another one's story of how I came to the decision. So once again, I'm pretty excited, and just wanted to share that with you, and I'll be back for another video at another time. Thanks, y'all. Bye.